Hello. Okay, so I know the title of this technically is Heart and exercise is very important for the heart, but you're going to read about exercise in the textbook quite a bit. So I wanted to discuss with you today actually heart health and different things that affect your heart's health, because these things are important. And if you actually learn these now, when you become an adult, you actually will be ahead of the game because these things are very important to your heart health, and these things are things that you can definitely use in the future. And whenever you become an adult and you go to a doctor and you have a physical, they will talk to you about these things and tell you certain numbers. And so today I'm going to tell you about cholesterol, blood pressure, triglycerides, and we're going to talk a little bit about heart disease. And I'm going to give you some numbers that tell you what a normal range is versus a abnormal range, so that later on, if you can remember them when you go to the doctor as you get older and take physicals, you'll actually know what the doctors are talking about. So, first of all, what is cholesterol? Cholesterol is a soft, fat-like, waxy substance. And it comes from two different sources. First of all, your body actually makes cholesterol in your liver. That is a genetic thing. Some livers make more cholesterol than others. It depends on your genetics and what kind of genes you inherit from your parents. That part you can't do much about. In general, the liver makes about 1,000 milligrams of cholesterol a day. But the other part of the cholesterol in your body comes from food sources, things like animal products, meats, poultry, fish, eggs, butter, whole milk, and cheese. Anything with a lot of fat in them actually has cholesterol. Also, things like now there is no cholesterol or very little cholesterol in plant sources. So things that are plants generally don't have cholesterol, but things like animal meats, eggs, butter, whole milk, cheeses, things that come from animals actually have 100 to 500, you get 100 to 500 milligrams of cholesterol a day from those. You'll notice these are all the foods that we kind of talked about that we said were not necessarily super good for you, with the exception of chicken and fish or poultry and fish. But the others we talked about how they weren't super good for you when we were talking about diet nutrition. And then you also get them from foods with trans fats or saturated fats. Those are those bad solid fats that we talked about during nutrition, and they can cause your body to produce more cholesterol. So cholesterol is actually transported throughout your blood, and there are two types. There's low density lipoprotein and high density lipoprotein. Don't worry about the big fancy long term. What you need to remember is LDL cholesterol and HDL cholesterol. But basically what lipoprotein means is it means protein plus fat. LDL has more fat in it and less protein in it. HDL has more protein in it and less fat in it. So guess which one we're going to say is probably the good one. Since we talked about how bad fats were when we talked about nutrition, it's going to actually be HDL. So LDL is considered to be bad cholesterol. The more bad cholesterol you have, the worse off you are. Too much LDL cholesterol or bad cholesterol will end up clogging your arteries and making something called plaque. When you have plaque on your arteries and your arteries are clogged, we call that disease atherosclerosis or arteriosclerosis. Sorry, I can't pronounce these things. And arteriosclerosis can actually cause heart attacks and strokes. Let me explain a little, and this is important because this is actually a topic that may be on the Cambridge exam. If you have too much LDL cholesterol, what happens is that LDL cholesterol ends up sticking to the inside of your arteries. So on the left here, this is a picture of a normal artery. It's got that muscular section in the center that we've talked about. It's got the elastic kind of inner band and outer band that we've talked about that makes it more able to have the blood travel through it. But notice on a normal artery, it is completely open. The blood can very easily travel through this artery. Now, when you get arteriosclerosis, the LDL, the bad cholesterol, ends up sticking to the walls of the artery, and it forms this kind of very hard, solid substance called plaque. Now, over time, the more bad cholesterol you have and the longer you have bad cholesterol, the more this plaque builds up on the inside of your arteries until finally it builds up to the point where it can actually seriously keep the blood from flowing through the artery, and sometimes it can close the artery off completely and block the artery completely. Why is this bad? Well, if you remember, we talked about the fact that your heart has arteries traveling on the outside of it that provide it with oxygen and provide it with glucose so that your heart can actually function. If those arteries on the outside of your heart build up this plaque and they get clogged, oxygen and glucose can no longer get to your heart and your heart will stop working. When that happens, you guys have heard of this one, that's called a heart attack. So if you get so much plaque clogging up those arteries that the blood can no longer flow through and provide oxygen and glucose to the heart, then basically you have a heart attack and that it can be fatal. Now, what's a stroke? A stroke is basically when a blood vessel in your brain ends up being clogged and the blood can't get to certain portions of your brain. So what'll happen in your brain is this plaque will build up in the arteries inside your brain, and eventually the blood flow will not be able to get through, and a part of your brain then can no longer get oxygen, and that part of your brain dies. And when that happens, or starts to die, when that happens, you have a stroke. Basically, you begin to slur your words, you become disoriented, you can fall down, and it can be a very serious condition. It can also be fatal. So LDL cholesterol is bad cholesterol. You want to not have that as much as possible because, again, it builds plaque on the inside of your arteries and then it clogs them so the blood can't get through. Now, there's good news, people. HDL is good cholesterol. And it actually tends to take that cholesterol that's back here on your arteries. It takes some of this plaque and this cholesterol, and it actually will send it back to the liver. It'll kind of take it off and send it back to the liver. It can also remove plaque from your arteries. So basically, HDL is good cholesterol. It helps get rid of the bad cholesterol and the plaque on your arteries. What are triglycerides? Triglycerides are a form of fat. They are also made in the body. The body actually stores fat as triglyceride, and you can also get them from food. Triglycerides will trigger your liver to make more bad cholesterol. You remember your liver does make some cholesterol, and it's the bad cholesterol. And basically, the triglycerides trigger your liver, tell your liver, hey, make more bad cholesterol. So triglycerides are not good for you. You want to have as few of them as possible. So, remember I told you I'd tell you some numbers. Write these down, don't lose them, because as you get older, when you go to health exams and stuff, these numbers, your doctor will spew them out, and you'll be like, what are you talking about? So if you write them down or you can remember them, then you'll know what he's talking about. Total cholesterol is your bad cholesterol and your good cholesterol added together. So if you take your bad cholesterol number and your good number and you add them together, that's the total. The best cholesterol number should be under 200. This is milligrams per something liter. Don't worry about that too much. Your doctor's not going to go into all that. He's going to tell you a number, 100, 150, 170, 200. You want your total cholesterol to be under 200. Now, if your cholesterol is 200 to 239, that means you're borderline at risk for having arteriosclerosis and heart attacks and strokes and that type of thing. If your total cholesterol is above 240, that means you're at high risk for having strokes and heart attacks and heart disease. So you want your total cholesterol to be 200 or less, and again, the lower the better. Now, then your doctor will tell you what your LDL number is and your HDL number is. You want your LDL number to be less than 100 milligrams. Okay, so less than 100. If it's less than 100, you're in good shape. If it's 100 to 129, you're still probably okay, but it's starting to creep up there. If your LDL number is 130 to 159, that means you are at borderline risk for having heart disease. If your LDL number is 160 to 189, that means you're at high risk for heart disease. And if you're 190 or above, that means it's very high and you've got some issues you need to go see. Well, you've already seen the doctor because he's giving you the number, but I'm sure he's going to put you on a diet or something. Okay, so now HDL is the good cholesterol. And again, if they want that to actually be 40 milligrams, if it's less than 40 milligrams, it's too low. My bad. So the good cholesterol, remember, the higher the good cholesterol, the better. So if it's less than 40, it's too low. You need to start working on getting it up there. Okay? If it's above 60, that's good. Okay, and that may actually lower your risk for heart disease. Guys, women tend to have a higher HDL because they have estrogen. It's a certain type of hormone that women have, and they have more of it than men. So they tend to have higher HDL, so they won't need to be over at least over 50. Triglyceride numbers. If you have 150, remember triglycerides are bad. So if you have 150 or less, it means you're in good shape. 150 to 199 means you're on the edge of having heart disease. Above 200, bad news. You actually are at high risk for having heart disease. So what affects cholesterol? Again, part of it is genetic. Your liver makes bad cholesterol, but a big part of it is diet. And that's why we talked about nutrition earlier and eating a healthy diet. You want to eat more poly and mono unsaturated fats than you eat saturated fats. Guys, in a nutshell, remember we talked there were good fats and bad fats. The good fats were liquid fats and they came from plants. Olive oil, canola oil, vegetable oil, peanut oil, sunflower oil, anything that comes from plants. The bad cholesterols are things like butter, or the bad, sorry, fats are things like butter, grease, animal fats, any kind of fat that comes from any kind of animal, those are bad. So you want to limit the bad ones and substitute them with good ones. If you eat high carbs, a lot of carbohydrates, a lot of white bread, cookies, sugary drinks, sugar, or you drink as an adult too much alcohol, that can actually increase your triglycerides, which remember will tell your liver, hey, make more bad cholesterol. Okay? And again, soluble fiber, guys, if you eat fiber, that actually will lower your bad cholesterol, but it doesn't lower the good cholesterol. So it actually will help you. So this all goes back to the nutrition part we talked about earlier in the year. Eat a little amount of fat, and if you eat it, make sure that it's plant fat, it's liquid. Eat whole wheat bread and things that are high in fiber and not things that are high in sugar and processed flour and white flour. If you follow those, it will help your cholesterol. Other things that affect your cholesterol are weight. If you are overweight, it tends to make your cholesterol higher. If you exercise, your cholesterol actually goes down. And other things like age, gender, and again, guys, some of it is hereditary. Some of it comes from your genes. So why does it matter? Coronary disease is called, again, arterial sclerosis. It is the single leading cause of death in America. It is the highest category for what causes deaths. It's heart attacks mostly and strokes. The higher your LDL is, the higher your bad cholesterol is, the higher your risk is of having a heart attack or a stroke. Also, other risk factors, things that put you at risk, are as if you smoke, if you have high blood pressure, which we'll talk about in a minute, if you have low good cholesterol, if you have a family history of early heart disease, and again, age, guys. Somebody who's 10 is much less likely of having heart disease than someone who's, 60. So age is part of it too. How do we prevent high cholesterol? Well, first of all, when you're an adult, you need to go get it checked by a doctor. Watch your fats, eat healthy. Actually, foods have cholesterol in them, so try to consume less than 300 milligrams of cholesterol a day. If you look at the labels on food, they will tell you how much cholesterol is in them. Be active, energetic, exercise. Never start smoking because if you start, it is addictive and very difficult to quit. So if you never start smoking, that will be a big plus and help you keep your cholesterol in check. If you're an adult and unfortunately you already have started smoking, they recommend that you quit. And then for those people who just have genetic issues where their body just makes more cholesterol than it should, there are medications out there that the doctor can give to help lower cholesterol. They're called Lipitor, Crestor, Zocor, Vitotrin, and Zetia right now are the top ones. So blood pressure. Your blood pressure is basically how your blood travels through your body, how it pumps through your body. 1 in 3 adults have something called hypertension. Hypertension is high blood pressure. The thing is, you have no symptoms, okay? And nearly a third of adults out there don't even know that they have high blood pressure because there are no symptoms. And doctors aren't sure yet of what the cause of high blood pressure is. Now, when you're talking about blood pressure, you have systolic and diastolic. Systolic is when your heart is beating, the pressure that your blood is going through your body when it's beating. Diastolic is when your heart rests. That's the bottom number, and it's the pressure when you're resting. So basically, it's the pressure when you're beating and the pressure when you're resting. A normal blood pressure for an adult. Now, kids are different, so ask your pediatrician if he takes your blood pressure when you go in what a normal the rate is. But for an adult, a normal rate is 120 over 80. That means your systolic, when your heart is beating, the pressure shouldn't be more than 120, and when your heart is at rest, it goes down to about 80. If you have a little bit of high blood pressure, you'll be between 120 and 139 to 80 over 89. If you have high blood pressure, then you're at 140 over 90. Why is this important? Because high blood pressure is one of the factors that cause you to have a risk of having heart disease, strokes, and heart attacks. So if you have high blood pressure, you need to see a doctor so that it can be fixed or so that you can take medication in order to try to bring it down. This is the number one controllable risk factor for strokes. So the number one thing you can do to keep from having a stroke is when you become an adult, go get a physical at the doctor every year or every 2 years. When you're younger, it can probably be every 2 years. When you're older, it needs to be every year. And have them check your blood pressure. And if it's high, talk to them about how to bring it down. What causes high blood pressure? Again, we don't know for sure, but they have linked salt and sodium to high blood pressure. They have found that the more salt you eat, the more your body holds liquids and fluids in, and that makes your heart have to work harder, and it makes the pressure go up. They have found that eating more potassium, things like bananas and things that have potassium in them, actually can help with that. How do you control high blood pressure? Well, again, the more overweight you are, the more chance you have of having high blood pressure because your heart has to work harder to pump all the blood through your overweight body. You need to reduce the fat in your diet and make sure that you're at a healthy weight. Again, guys, make sure it's a healthy weight, not too low, not too high, healthy. If you smoke, first of all, don't start smoking, but if you were to smoke, you need to stop. If you were an adult and you were drinking alcohol, your doctor would tell you to cut back on alcohol. Again, drinking alcohol, even as an adult, guys, is not a great idea. And if you choose to do so when you become of legal age, I highly recommend drinking it in moderation. Well, the less, the better. Being active, working out, and the doctor can give you medication in order to bring your blood pressure down. And also, guys, stress, actually, they have found causes higher blood pressure. So learning how to deal with stress, taking deep breaths, yoga, meditation, taking some time to relax every once in a while, that will help with high blood pressure as well. So, heart disease risk factors. Age. Males tend to have more heart disease than females, although that number is coming closer and closer together. And again, heredity can have a big deal to do with heart disease. They've found that African Americans tend to have higher blood pressure, also among other races as well. That does not mean that if you are not African American, you're not going to have high blood pressure. There are plenty of people of other races that have really high blood pressure. Also, things that you can control. Don't smoke. Make sure that you have a healthy diet and that you increase your good cholesterol and bring your bad cholesterol down through a healthy diet. And make sure if you have high blood pressure, you eat a healthy diet, try to get it down. And if you can't get it down to where it's supposed to be, you see a doctor and take medication for it. Other things that you can do to avoid heart disease: physical activity, working out, sports, keeping active. That keeps your body in prime physical condition. It keeps your heart exercised. Remember, we said your heart is a muscle. So if you actually work out, your heart pumps faster and your heart ends up working out and you end up basically keeping your heart healthy and keeping that muscle healthy. Making sure that you're not overweight. And guys, they have actually found that people who are overweight, if they have more of a belly, they tend to be at more risk for heart disease. So people who are overweight and look more like an apple instead of a pear, they tend to have more risk of heart disease. And then also, if you have diabetes, you can be at more risk. Other factors are stress, and again, alcohol is no good for you guys, so try to stay away from it.